Well, hello everyone. I think I am on now. I want to welcome you to our fourth episode of Prodigious Kentuckians. And just a quick note, we are now on YouTube and on various podcasts out there. And by request, we now have our very own Facebook page. We've had it for about a week now. And we have the past four or so shows stored there. I'm your host, Trent Garrison, and this is my co-host, Julie Martina. I don't know which direction she is, but this is my co-host, Julie.
Oh.
Hello, Julie.
Hello, Trent. I'm excited to be here tonight and really interested to hear the stories that we're going to have from COVID survivors, and also happy to have Dr. Hasselbacher with us as well. I think it's going to be a great show.
All right, great. Well, I feel like I've seen you quite a bit lately on Zoom, Julie. That's a good thing, I guess.
I think pretty much every day since Sunday.
That's right. There's a lot going on. Yeah. Well, tonight's show is on the COVID-19 pandemic. It's something that I think is on a lot of people's minds these days. And probably at this point, it's affected most people in one way or another. Maybe not directly, but at least people that you know. And I wanted to have this program so we could give an opportunity to provide personal stories as well as some medical information to people. So for our show tonight, we have three guests who have had COVID. They're going to jump on here in just a little bit. And we also have Dr. Peter Hasselbacher, who's a retired professor and medical doctor from University of Louisville. He's president and founder of the Kentucky Health Policy Institute, and he wants me to call him Peter because he said he didn't want to be too formal. So we'll go forward with that. So I'd like to go around and just give everybody, if our guests could jump on now, I'd like to go around.
On here, I just cannot see myself.
Oh, okay. You may have to restart your video. There we go. There's Amber.
It says you cannot start your video because the host has stopped it.
Oh, okay. I will. We'll get that fixed in just a second.
Okay.
So we have three guests who have had COVID recently, and what I would like to do something a little bit different tonight. I would like to have just go around and let them tell their stories. And after that, we can have a little bit of a conversation and have Peter come in and talk a little bit about the statistics and that sort of thing. But if we could, let's start out with Barry and just introduce yourselves and tell us your story about how you got COVID and going forward from there.
Hey there. Well, first, thanks for having me on. I appreciate it. And greetings from New York. So I got sick with COVID on April 1st, back when we were still kind of in the discovery phase of this thing. So testing was hard to come by at that time. We really didn't have much. I just got diagnosed by symptoms via a virtual doctor visit on my third day. My first symptoms were just a pounding headache, fever, dry cough, fatigue, which was just tremendous. There's tired and then there's fatigue, and it was a whole new world for me. It was just like one of the people that I talked to described it as it's like being hit by a truck and then chloroformed. That's what it feels like. So my acute symptoms lasted about 2 to 3 weeks. Again, I had a fever for about 2 weeks going. That subsided after about day 15 or 14. Cough stayed on probably till the end of the third week. The fatigue then kept all the way through. So I've just passed the 8-month mark, and all through these 8 months, I have fought again, the crippling fatigue at times. I've had neurologic symptoms, numbness, tingling in my fingertips, brain fog, difficulty concentrating. And I also had to have hernia surgery in August because it wasn't really confirmed, but it was likely due to all the coughing that I did during my acute phase. It was pretty bad. I had one night, I think around day 12, where for about a 15 to 20 minute stretch, I couldn't breathe without coughing. And I thought this was going to be the episode that was going to land me in the hospital. And back then, you did not want to end up in the ER because Back in early April here in New York, you checked into the hospital and there wasn't a good chance of you checking back out again. It just was, they were still figuring out what to do. Somehow I got that turned around, but I think that took its toll on my body. And right now I'm still recovering from that. Meanwhile, all of my blood work was coming up pretty much fine. As with many long haulers, which we're calling ourselves people who've had this for months and months, a lot of our blood work is fine. And it seems like what we're discovering is that it seems to hit younger, healthier people longer, and people with underlying conditions harder and faster. So myself, I was, supposedly in the low risk group. I'm 51 years old. I exercised every day. I followed a paleo diet. I hadn't eaten refined sugar in probably 7 years. I don't eat gluten or dairy, and I'm fine. And this thing rocked me. But finally now, I guess thanks to time and taking care of myself and going online and finding support groups on Facebook, and all of us just kind of figuring out and sharing what worked with each other for weeks that went on months and months. We've all just kind of helped each other find our way through this. Some people are still struggling way more than me, even after longer times. But I'm now just finally getting back to some kind of normal function. Today I was able to walk almost 2 miles, with some hills in there and with some stairs. And, a month ago, if I even tried that, I would be in bed for a day and a half afterward. It was like you couldn't push yourself too hard, because then your body would just like reject that and you would be flattened for a day and a half, maybe even 2 days. So it's this, you want to build yourself back up, but your body just keeps kicking you back down. There's a real 1 step forward, 2 steps back kind of thing. But now, thankfully, finally, hopefully getting out of the woods with that. And just trying to spread the word out there and get people understand this can happen to you. We used to think, back when I first got it, it was like, oh, okay, if I fight it for 2 weeks, that 2-week period, and then, oh, you're over it and you're done and you're home free. Nope. It doesn't necessarily, it's not the case for everybody. So this thing is so weird, so strange, and it's still baffling us to this day.
Yeah, Barry, I forgot to tell the story. You and I met in Louisville 11 years ago. We figured that out earlier on the pre-show chat, and that's how we got to know each other. We both used to play music, and we were at the Galt House. Yeah. And we just I've been friends with him since then on Facebook, and I saw that he had contracted COVID in the early days. And that's when, New York was blowing up. So, I'd followed his journey. He'd been really good about putting it out there on social media, which, I really appreciate the people who have done that. So we're glad to hear that you're doing better. Sorry that, you got one of the bad ones, and it took a long time to recover, but we definitely appreciate you being here and sharing your story.
Yeah, if I may, as a quick side note, my wife got sick shortly after me.
Oh, she did? Okay.
Younger than me, and she has rheumatoid arthritis, which should have made things go worse. So, and she was probably sick solidly for about 2 weeks, never got cough, never really got fever. It flared up her RA really bad. But after that couple of weeks, she was back to normal again and fine. She's been exercising for months and months, and she's totally fine. So go figure with this virus. We just don't know.
Yeah, absolutely. Well, thanks for being on. Story, I'm going to come to you next, if you don't mind. I apologize for the technical difficulties earlier, but it's good to see you again. It's been a while.
I know, it's good to see you.
Yeah. Thanks for being on. We're friends on Facebook too, and used to be neighbors. I don't know if you still live over there close to me or not, but we didn't get a chance to talk about that. But we met maybe, I don't know, 5 years ago or something, and just I've kept up with you on Facebook and stuff over the years, and I saw that you had it, and I reached out to you and asked if you'd be willing to share your story, and you said you would. So here we are. If you don't mind sharing your story as well.
Okay, so I actually just had it more recently. I was diagnosed on the 19th, and the symptoms hit me on Wednesday, November 18th. And I'll never forget it because I felt bad, like my body hurt. I mean, and I just kept telling myself, well, you know, when you hurt your back a couple years ago, you know, the seasons are changing, So I just kept pushing through and, you know, just trying to figure it out. And then all of a sudden I got a headache. And I don't get headaches. So I'm a very rare, blessed person that never gets a headache. So if I get a headache, maybe once every 5 years, I know that, you know, something is wrong. And so I was like, you know, I have a headache. And my children were like, what? And I was like, I have a headache. And so like I would say within an hour, I went from just talking normal and just kind of babying my hip to being completely laid out and not being able to talk. So at like that next morning when I woke up at like 10:30. So I had to call into work and like do everything in my power to find like an urgent treatment that would take me, because everybody was like, well, you have COVID symptoms and we're not taking patients with COVID symptoms, which is insane. Like you would think with COVID being a pandemic, all of the urgent treatment centers would be set up to take COVID patients. But I was turned away from 2. And they were like, we don't take patients with COVID symptoms. I was like, okay. So finally, I just went to the door of one and they actually had a sign that said, if you need a COVID test, make an appointment. Any other test, ring the doorbell. So I just rang the doorbell anyway and was like, I don't know what's wrong with me. Like, I don't care what test you give me, but, you know, I need your help. I need you to fix me because I still had this headache. And I couldn't function. Like I said, I don't get headaches. So the moment my head was hurting, I was out, like down for the count. And I had to drive myself to try to figure out what was wrong with me. So they did the COVID test. It came back, of course, in 15 minutes. They sent me to St. Joe East. And I was in St. Joe East for 10 hours because I was so dehydrated that they had to just keep me hooked up. And so finally, when they released me, they were like, don't drive. So I had to have somebody come get me. And I was down for the count for 2 full weeks. I could not move. My back hurt. I think I had every symptom to man except for the fever. I never got a fever. I had chills. I had aches and pains and you would think that I had a fever because I could be just sitting watching, you know, a TV show or sleep, and I would wake up just covered in sweat. Or if I moved from one space to the next space, I was covered in sweat. And I looked like I had a fever and never broke a fever. Never had a fever. My fever never went from 98.6 on any thermometer. It stayed. So I never could tell, you know, what that was all about. But they were like, well, you know, people are getting chills, getting cold chills, and then spiking hot, and they're not getting a fever. So I had that, and I still have that. Like right now, I don't know if you can tell, but I'm very sweaty right now, and that is just because I'm talking. And like anytime I have to talk for a really long period of time or do anything that exerts too much energy or effort, I break into a sweat. I'm not as tired as I was, but I immediately get hot and I'm sweating and there's like nothing I can do to control it. And that started a couple of days before my back started hurting, was the sweating. And I just kept saying, oh, you know, I'm old, I'm going through menopause, is what it is. You know, like this is just something that happens, no big deal, you know. And then my back hurt. Oh, you know, I hurt my back a couple of years ago. It's fine, no worries, you know, seasons are changing. And then boom. A life has been altered because like I still can't taste things the same. Still when I eat, I take like really small bites of everything individually. So kind of my brain can tell me what it's supposed to taste like, because the minute I mix it up together, it's over. I don't have any way of discerning any of the individual flavors. And that kind of sucked for Thanksgiving because I don't know about you guys, but I like to kind of take the fork and you know, couldn't do that. So yeah, it's been crazy, and I've been back to work now for about a week, and I can tell like it's a completely different. Everything about my life from before COVID to right now at 3 weeks out, has changed, and I'm not sure when it'll go back to being the same.
Well, we're glad you're starting to feel better, and you know, kudos to you for coming on, even though you're still sick with it a little bit. We appreciate that. You know,
Absolutely.
another friend of mine had it, and she mentioned the taste thing. She's been kind of documenting it online as well, and she said that she can taste like salt, and that's like the only thing that she can taste. I don't know if it's the same with you.
And you can, I could distinguish really well between salt and sugar. So if it was really sweet, I could taste it. And if it was really salty, I could taste it. So for about 2 weeks, I lived off of those peach flavored protein drinks. And I'm not exactly sure what brand, because a friend of mine brought them to me. But because they were sweet, you know, they had like such a sweet flavor, then they were really, really good. You know, like I was like, ooh, I can do this. But anything that had a kind of a bland flavor, there wasn't anything. So I did eat ice cream too, because, you know, why not? I could taste all the sweetness of the chocolate.
That's right. Yeah. Well, thank you so much for being on and sharing your story. We'll jump over to Amber, then we'll just come back and have like an informal. We'll compare some notes a little bit later. But thank you very much. And Amber, we don't know each other, but we have a mutual friend who she reached out and told me. She said you have to meet this person. She's had a little bit of a rough story, and here you are. So happy to have you on, and thanks in advance for sharing your story.
Oh, well, thanks for having me. So I kind of typed my story out since I've got a little bit of a longer one. I'll be as quick as possible. So my name's Amber Bashir Tarter. I'm a nurse practitioner, and I work in Somerset, Kentucky. I cover 8 counties in southeastern Kentucky for the VA. And so I'm not in a nice, clean doctor's office. I have a government car, and I'm out and about in the community seeing the veterans that are too sick to get to the doctor. So when COVID hit, we're still out in the community. So that meant we went in the homes. We do have PPE, but it was a little scary to say the least. So I've been in healthcare since 2001. I'm a healthy 42-year-old, no health history. When they first opened the drive-through clinics, they opened one in Somerset, Kentucky. And because of our patient population being very geriatric, extremely sick, our management advised us if they open it up to healthcare workers, you should run through and make sure you're not an asymptomatic carrier. So I called my nurses and I said, I'll be the guinea pig. I'll go. We all laughed about it. It was, you know, I had 0 symptom. I went through on a Wednesday. It was in April. And then they called 2 days later and said, you're positive. I was floored. I had no symptom. And it really took 2 days after that I then developed headache, fatigue, and then loss of smell and taste. My symptoms that time were pretty mild. I mean, it was about 5 days of headache, fatigue. To be honest, I didn't take off work. I worked from home and did visits through telehealth. So that tells you I really wasn't in the bed sick. So on day 5, I started having tachycardia, which is an elevated heart rate, out of nowhere. No health history of any heart-related incidents. At first I thought, well, have I worked myself up? Is it anxiety? But it woke me up out of sleep. It continued for several days, and I kept, trying to talk myself out of it. Finally, when I went back to work out in the community to see patients, I knew I didn't feel great. The fatigue, like Barry said, I mean, it hits you. I mean, you're just walking up the flight of steps is absolutely taxing to no end. I would go see a patient and be in a home an hour and come out to my car and have to sit there and take deep breaths. So finally, after a couple of weeks of dealing with that, I had palpitations, which were just fluttery feelings in my chest, fullness in my throat that kept making me cough. I knew something wasn't right, but being in healthcare, that's hard to admit. So I finally called a cardiology friend of mine and said the first step's admitting you got a problem, right? So I've got a problem. And after labs and tests and monitors and everything, I was diagnosed with viral myocarditis, which is inflammation of the heart wall. I had arrhythmias when they hooked me up to the monitor. I was having and I'll use some medical terms, it doesn't matter, but just in case there are medical people out there. So I was having PACs frequently, PVCs, and SVT, which is supraventricular tachycardia. My heart was at risk for going into lethal ventricular arrhythmias, and I had developed high blood pressure. So I was placed on several medicines, which was hard to swallow because before this I took a multivitamin and some vitamin D, and that was it. And I was completely healthy. So my daily regimen started with about 8 or 9 pills and a blood thinner to keep me from having blood clots. And it ended with, 6 or 7 pills. It was just very hard to swallow that I had gotten so sick because I wasn't what you would say acutely very ill. So that was really hard for me. I was told it would take 6 months to a year for my heart to recover from the damage that COVID had caused. And so I started to cardiac rehab myself, walking in the evenings as I could, just trying to gain strength and get back to my daily routines. So now, 7 months later from that, I'm happy to say my last cardiac MRI that I just had showed the damage has resolved. Yay. I'm off all of my medicines except one for blood pressure because my blood pressure is still slightly above goal. And so that's been great news, and I feel wonderful. There were times where I felt like this is my new normal, and so that was hard. That was the first infection. Second infection was in August. So that was 4 months from my initial infection. And I will say, my first infection, I have no idea. I'll never know. I was in 4 different counties. I wore PPE. I was in homes with patients that had come out of UK and VA in Lexington who had been on ventilators, who had various respiratory failures. I have no idea where I got it. I got it. So the second infection was in August, and it was my fault. I let my guard down. I had been very, very careful and only, being around my immediate family in my home, but I had a close friend, and I was unmasked and with her for a few hours. Unfortunately, about 3 hours after we were together, she developed a fever and called me. She was treated for a sinus infection, but 3 days after I was with her, I developed a low-grade fever, 99.3, nothing real serious, but I self-monitor for work. So when I woke up and I had checked my temperature and it was a little elevated, I didn't see patients that day. I thought it could be anything. It could be just some other respiratory symptom, virus going on. I did test that day and I was negative, and that was just a antigen quick test. 2 days after that day, my symptoms worsened pretty severe. The chest congestion, extreme sore throat, fatigue, nausea, diarrhea, headache. I was at high fevers. I really thought I had influenza with probably developing pneumonia, and I felt like it was probably just where my immune system had been wiped. I was seen at my local provider's office, and they did flu and strep, and they actually did a chest x-ray. Everything was negative. And so at that point, they did do a send-off PCR testing for COVID. And still, I just felt like I'll kind of get into that. But in the back of my head, I thought, this cannot be happening. This cannot be happening. And I just kept thinking, my immune system has to be just shot. So then the next day after I was seen, I woke up and I had no taste. And I knew I didn't need a test. I knew it was COVID. Nothing takes your taste away like COVID. To the point where you can pour red pepper flake on your tongue and you can't taste it. You can pour Tabasco sauce in your mouth and you cannot taste it. So it was confirmed 2 days later that I did have COVID. At that point, I was established with infectious disease at UK. I was in bed sick for 10, 11 days. I took care of myself. I mean, I really didn't want to go to the hospital. So I did all the things you hear about. I laid on my stomach. I slept prone. I did nebulizing treatments 4 times a day. I took Mucinex, Tylenol, monitored my vital signs, and had multiple Zoom visits every other day with the infectious disease department to try to keep me home and out of the hospital. Of course, they were most concerned with my heart. And weirdly, I had 0 heart issues that round. None. I mean, I was on a plethora of medicine. So who knows if the medicine, was what kept my heart from acting up, but I was super sick, acutely sick, like what you would think might affect your heart, not like the first time. So what we learned from that is the disease severity doesn't correlate. I mean, you don't have to be super sick from COVID to have lasting long-term effects and to be, like Barry said, a long hauler. So anyways, as for long-term effects from the second one, I recovered in like a month. I'm going to say I was back to walking 3 miles. Before, I could have never done that. When I was infected in April, it would have taken months and months to get back to my baseline, but I recovered quite efficiently, and my heart was at its baseline. I did have the rash both times that Starry talked about. It's about 3 weeks post-infection that I developed the rash. Now, I've had tons of questions about, are you sure you had it? You really had it twice. So here's that story. So I had antibody testing after my first infection. I was at 6 weeks out. And so I had the antibody testing at UK. They had pretty good specificity for COVID-19. I was negative for antibodies. So they asked me to come back in a few weeks and retest. I was tested again at 15 weeks out, right before my second infection, and I was still negative. So I knew that there was a chance that I could be reinfected. I knew that. Just not that antibodies mean everything, but they do correlate some. So I was aware that I needed to be careful. And for what reason, I didn't know. I thought maybe it was just a low viral load. I really didn't get that sick the first time. So maybe that's why I didn't develop the antibodies. Now, after the second infection, infectious disease wanted, of course, to run antibodies again. So at week 7, post-infection number 2, I had antibody testing, and everybody felt for certain you'll have, as sick as you were, you will be good. You've got to have some kind of immunity. And I don't. I had very little. So I've been enrolled in 2 longitudinal studies through the University of Kentucky. One is on immunity, and the other one is on cardiac and coagulation, which is clotting issues. And they've studied numerous factors of my immune system, which are completely healthy. And there are other people like me that just don't mount an immune response to the virus itself. They do feel like that with the vaccine, that there will be better coverage for people like myself, and that we will mount once we're vaccinated. So I just hope in the next few weeks or so that will be the case, and that we'll find out, because they will be looking at that. So in my family, the first time nobody else was infected in my household. The second time my 13-year-old daughter was infected, and she was mildly sick 4 to 5 days. She really looked like a strep throat kid, just fever, sore throat. She recovered really quickly, and actually she had antibody and immune testing at UK as well, just because they were kind of curious. And she had beautiful antibodies and T cells and B cells, and her cytokines and all the things that they look at. Interferon looked great. So who knows? Just, some girls have all the fun, I guess. But loss of smell and taste, my taste is still altered. I can smell, but not as good as I once could. And other than that, I really don't have any lingering effect. I can honestly say that I'm 100% recovered from both COVID infections, but nothing says that it couldn't come back again. I kind of feel like I'm on Final Destination, dodging the bullet here. So, but that's my story.
Trent, can I say something about her story?
Please.
Okay, so when she said her friend came over, it reminded me because I got COVID from my son. He's a student at Kentucky State University, and he came home and he wasn't feeling well, so I sent him to the doctor, and the doctor told him he had a sinus infection. And when she said that, I was like, yes. So we thought he had a sinus infection the entire weekend that he was home. He was taking his antibiotics. And of course, I was taking care of him and sitting beside him and rubbing his back because over the weekend he developed a horrible headache. But by Monday, he was fine and he left and went back to school. So that was on Monday of the week I was diagnosed. So like Monday he left and went back to school. He never had another symptom. By Wednesday, I was completely taken out. Thursday, I got tested and had COVID. So he went and got tested and he was diagnosed with COVID as well when he went and got his COVID test. So we both had it, but we knew, I was like, I think that, my son gave it to me, but his symptoms only lasted about 4 or 5 days and he was up and back at school and he hasn't had any lingering issues at all.
Right.
I don't know what to say, Amber. I mean, that's a hell of a story. You'll never forget that as long as you live, I'm sure. And yeah, I can't thank you enough for coming on and sharing that. Hopefully, people will see this, enough people will see it and share it that they will have a good sense of what it's like and how it varies from person to person and how severe it can be. But thank you all so much for sharing that. We'll have some more questions and comments in a little bit. But I wanted to get Dr. Hasselbacher in here too. He's going to talk a little bit about it from his side of things, maybe some statistics, and then we'll come back and talk a little bit more. So you should be, if you want, I don't know if you want to share your screen or just talk about it informally, but you should have that ability should you need to.
Fair enough. I'm really not sure where to start. Let me say at the outset that at age 75, I'm one of the old gomers that's vulnerable, but I haven't been a practicing physician for a long time, so I'm not going to comment too much on. I'm not an authority on what's best and newest. I've been an old medical school professor my whole life, rheumatologist, internist. I had a laboratory, an immunology laboratory for the longest time, did laboratory and clinical research, and got interested in public health because my patients were all getting the shaft in our healthcare system, and I wanted to try to figure out what was wrong and make it better. So I got interested in health policy. That turned into interest in government relations, and actually finished my career more as a lobbyist than as a physician for our medical center and for medical schools around the country. Let me, before showing some numbers, if we have time for that, because I asked myself the question. I'd been interested in the hepatitis C and the hepatitis A epidemic in Kentucky, and I used to help teach medical statistics. And so when our epidemic of COVID started, naturally I was interested in that. And I asked myself the question, how can we tell if we're winning? And that's what led me to develop the portfolio of slides. And I'll show you one or two of them just to try and convince you that no, we're not winning. But let me make a few comments about what our friends have said who have actually personal contact with the disease. And that's, this is a brand new illness. And in many ways. And we're still learning as we go, how do we diagnose it? How do we treat it? Because in the beginning, there was a big emphasis internationally and here on pneumonia and people getting intubated and put on respirators and dying of pneumonia, that it took us a little while to realize that, gosh, pneumonia and death are not the only bad outcomes from having coronavirus. COVID-19 is the name of the syndrome that this strain of coronavirus causes. So we use them interchangeably, but one is a virus and one is a disease spectrum. Over the months, study of patients both living and dead made it very clear to us that this is a multi-system disease that has manifestations throughout the body. Part of it is that the virus has a preferential interest in damaging the blood cells that line our little arteries, that line the air sacs in our lungs, so that basically anywhere a blood vessel can go, you can get involvement in this disease, which also activates the clotting system throughout the body. It activates the complement system. It activates the clotting system. It starts all of our usually protective, inflammatory protective mechanisms in a non-discriminate way that actually causes disease. So even in some very early, unfortunately, autopsy studies in the brain, you would see tiny little infarcts to tiny little mini strokes, as you were. In the kidney, there would be damage to the kidney. Maybe, people who have kidney disease can get back pain. Some people with COVID disease have to be put on dialysis in the hospital. Their kidneys fail that much. Myocarditis is a big one. Not the widowmaker main stem, big heart attack problem, but out in the periphery of the heart, the little teeny vessels that can cause some inflammation as the tissue breaks down. It can cause atrial fibrillation and other things, and make your heart enzymes go up, so that the emergency room doctor may say, gee, you're having a heart attack, your enzymes are up. Well, that's because there's all these tiny little infarcts there. Rashes. The smell thing was curious at first, because people who did MRIs and they saw some parts of the front of the brain, lighting up, but it turns out that the virus attacks the little helper cells that surround the smell nerves that come down through your skull into the sinuses, and so we're learning every day. I get all these medical feeds, and every day I see that we're learning a little bit more. And just because we didn't have perfect knowledge before doesn't mean that we were faking it, or that it was a fraud, or we're learning as we go along. I guess it was, as Barry said, gee, younger people seem to be doing better. Well, younger people don't get put on respirators as much, but the fastest growing group since the summer really has been school-age children and 20-somethings. Now, these are people with positive tests. So yes, we're testing more school kids. Yes, we're testing more college kids, but the group that's not getting sick, as a group, us oldsters, we're not the rapidly expanding group. We get worse problems. We may have 60% of the mortality, but it's the younger people, including the very youngest, who, while they may not get terribly sick, some do, and they may be getting sick in ways they're not aware of that may take years to show up. But those younger people can certainly spread the disease. And I'm sorry, I didn't get Agudino is the name that I have on my screen here, but the story of catching it from her son, who wasn't all that sick, but that's a pretty typical story. Testing, my goodness gracious. Early on, it was just a miracle of medical science that they synthesized, they found the virus, they synthesized its genetic sequence that's turning into vaccines that are going to become available in the very near future. We could do gold standard immunologic, 21andMe kind of Ancestry.com DNA studies on people to show that they had viral RNA in their systems. But that test doesn't become positive until 5 days after you've had your contact. By that time you've already spread the disease around, and even after you become symptomatic, that test may be negative for a couple of days. It may take a week or two or three even after 2 or 3 weeks, the virus test, the RNA test may be positive, but you can't necessarily infect anybody because the virus may be dead. And I say this only because we're hinging so much on testing. Test all those football players once a week, but by the time you get the test 5 days after the contact and another couple of days to send it to the lab and get it back, why bother doing the test, or why bother doing the contact tracing? Our contact tracing, we just weren't nimble enough in our data collection to be able to respond in a way to put the brakes on this thing early on. What else? What other notes did I make here? Let me just take 2 or 3 more minutes, and just because we spent all day yesterday, Trent and I and others, trying to figure out how to share the screen here. Let me show you, because I've got a whole portfolio of stuff on the Kentucky Health Policy Institute's website, Tableau website, including one animated chart where you can watch the spread out from Fayette County, where the first Kentucky state was, out into the rural area. I won't show that now, but I mean, every single county has got cases in it, and they're growing fast. The rural counties are growing much faster, taking than Fayette and Warren and Northern Kentucky and so forth. But let me just show you. Let me just show you 1 or 2 things. Okay, so in terms of new cases per day, I mean, let me make this go away. This is the number of new cases a day from early March until the present. I mean, one of the problems, well, immediately you see that, oh my goodness, we're going straight up. When's it going to end? When's it going to stop? Where are we headed? Well, I don't know. I got a little better handle, I'll tell you. But one of the problems is, look at all these gaps. So here you got one day, there's a zillion, there's 2,000 or 3,000, 2,000, almost 2,500. And then, you know, next day there's only a couple of hundred. To me, this was evidence that we don't have a good system in place. And by the way, this is replicated nationally. It's not just us. That we don't have we've never had a good system in place to capture the data. I got to get rid of my pictures here, put it over in the corner. So cases per week. How can I make this go away? I'll put it over here. I mean, this last week, we were at 24,000 new cases during the week. Are we winning? Now look at this. Oh, goodness gracious. Yes, the closing the bars really worked. We dropped off. But no, that was Thanksgiving and the fact that we had like 2 or 3 weekends in a row. Here's another way that people have been looking, trying to even out this weekly cycle of highs and lows. The red line shows 7-day averages, so that over a week, it takes out some of the variation. But look, where's it going? Straight up. And this is Thanksgiving week. So even, and I'll tell you, people were just as sick in this week as they were for the rest of them. Here's something that I make this argument on the website, but here's what happens if you take that 14-day average of new cases and you plot it in what's called a semi-logarithmic manner. This is not a linear graph. This goes, 20, 100, 1,000. This lets you put small numbers and large numbers on the same plot, but one of the corollaries of that is if it's exponential growth, like compounding interest or doubling, those points will go on a straight line. And I would put to you that since September, since October, this is Kentucky's data of new cases, we have been going up at pretty much the same rate. And if nothing happens, we'll be at 5,000 new cases a day before Christmas and 10,000 cases a day by middle January. Are we winning? I don't think so. And are we in a new plateau? Is this a new plateau here? Well, we thought it was a little plateau down here. But I don't do crossword puzzles very well, and my memory's not good enough for Sudoku, but I would put to you that we are still in trouble. We're not in as bad shape as other states. We're not like North and South Dakota. But these are our hospitalizations. Currently in hospital in blue, ICU in red. I had a hernia repaired 3 weeks ago, and in the post-op, they were boarding COVID patients in the post-op area because here in Louisville, where we have the most patients in the hospital, they're getting overwhelmed. Those are the kind of things I've been playing with. All of those visualizations are available on our website or on our Tableau public website, and I encourage you to look at them. But and I'm happy to respond to any other questions.
Well, thank you for that. I took a look at the website, and there's just a tremendous amount of information on there, especially with the charts and everything. I'm a big charts fan, so I appreciate those types of data. I haven't turned it over to Julie yet, so I'm going to turn it over to Julie. I'm sure she has some questions. I think she's been monitoring our Facebook feed for any live questions.
Yeah, first of all, thank you all so much for sharing your stories and just being really vulnerable and honest with, what your bodies have gone through, and being here to talk with us about it. I can only imagine that it's really frustrating to have lived this experience or still be living this experience and the impacts of it. And, to hear people minimizing it, denying the impact of it, not wanting to take personal responsibility for their own actions. I'm just curious, and to any of the three of you who want to jump in on this, from a mental health perspective of just what that's been like to have your bodies go through this. And then, we're all living through a pandemic, but you all have then lived the worst of that pandemic as well. What has that part of it? How has it impacted you just as you viewed the world and your relationships and in yourself? I know, Barry, you mentioned dealing with brain fog and, some of that kind of stuff. What's that aspect been on it, and how has that changed, kind of your perspective? Sorry, I know you said from 3 weeks ago, your whole life has changed, right? Because it's been that impactful. So I'm curious to know, what's that aspect of it been like for you all?
Well, for me, something that Amber said really rang true, where she had said, God, I wonder if this is just my new normal now. And that's just something, especially for, most of us who have these long-term things. It's just like most of us were healthy beforehand. So it was just all of a sudden, bam, you're not a healthy person anymore. And it's almost somewhere on the frequency or the spectrum of grief, of dealing with just loss of function. And the brain fog, first of all, there's the isolation. I was quarantined for almost a month, and just that, just my wife was here, coming in and out of this room actually once in a while, wearing a mask to just drop me food and then go back out. And that alone, just the isolation, the lack of human contact was just enough to just drive you mad on some level. But also the loss of function, both physically and cognitively, when I was able to get out, and there was a moment when I was driving, and it was someplace I hadn't been before. My wife was giving me directions. It's like your brain just kind of shuts down at some point, and like you have to make too many decisions. And I got to a 4-way intersection at a place I'd never been before, and I nearly had an anxiety attack because like my brain could not figure out something that was automatic for me before. And when you deal with that kind of stuff, yeah. And I had told people who had been through this similar, after me, I just said to them, when they were going through stuff like this, I said, whatever faith or spiritual practice you have, just lean into it heavily. And that helped me. Just, meditation and prayer just helped a lot. And thank God I just had a good support system around me. But yeah, it is taxing. And that, in addition to just the physical health aspect of this, that is going to be taking on our people and our country as a whole in the world. There's the whole mental health aspect that we got to factor in too. People are going to be in trouble from this.
Mm-hmm. Yeah, I agree.
Yeah, and I would definitely say the isolation was one of the hardest parts. I live with my 2 boys, and I'm a hugging mother. So, every morning I'm like, good morning. And, I'm hugging them on their way out the door or kissing them before they go to sleep at night. And for, 3 weeks, I couldn't touch them. I'm in my room with the door shut. And, we even came up with a system where we were using that Campbell's soup at hand, so that they could put the soup in the microwave, bring it and put it on my dresser, and then leave my room quickly, and then I could drink or eat, the soup and then throw it away. So nobody else had to actually touch it again after I touched it. And then even after they released me from quarantine, my oldest son, who never got COVID, was like, don't touch me, don't touch me. You know, like, I mean, it took forever to convince him that, you know, I could give him a hug because he's like, I do not want COVID. You know, like, you know, he don't want it. And it's like, you know, you want your friends to come back over and, you know, sit 6 feet apart. I never thought I'd, you know, miss sitting 6 feet apart. Before, that was a complaint. You know, I'm like, gosh, you know, everybody's got to be so far away, or, you know, I want all my friends in the room. And now I'm like, I mean, would you please just come sit 6 feet away from me? And they're like, no. So it's, you know, that is really, really hard to not be able to, you know, connect with people the way we used to. And if you don't think that COVID is a big deal, you should really think about how you're going to feel when you're isolated. Like, is it worth the risk? Because right now you can be 6 feet apart. Once you have COVID, you know, there's a lot of days I feel like I have the whole house to myself. Mm-hmm. And I work from home. So I'm always by myself. And that has been just, like, for me, it's been one of the hardest things to deal with. And with the brain fog, I think that comes at some of the worst moments, because I work for legal aid and I'm on the phone with people all day long. And sometimes you don't even remember the word. You're like, and it, you know, and it's a common word, and it's something that you have said so many times you couldn't count, you know, and you don't have it. It's not there. And you're like,
yep.
Yeah, really.
Yeah.
And people that have not had COVID, or I guess some other kind of, I don't know, brain injury, you have no idea what that feels like to just be like, you know, and it's not just like a regular, you know, brain that, you know, like it's just different. It's completely different, because you're just like, oh, you know, I know what I'm trying to say, but, and you really legitimately have no idea what it should be.
Yeah, it's a loss of control. It feels like just somebody pushed a button on your brain outside of you and just shut it off for a moment. It's just, yeah. Well,
and I'm only 3 weeks out, so for me, it still happens far too commonly. Like it drives me crazy. Is I'll be talking to my children and just stop mid sentence, and they'll be like, "What, Mom? What?" And I'm like, "I don't know," you know. And I'm like completely done with the conversation.
Well, we have about 5 minutes left. I want to be respectful of everybody's time here, so we'll do a little bit of a lightning round here at the end, where we'll maybe ask some. I've got a bunch of questions coming in, and we're running out of time, so maybe I'll shoot something out, and you just quickly answer a bunch of them at once. And Julie, if you have any too, maybe we can do that. So somebody asked online, does blood type have anything to do with severity in the medical community? Is there any evidence of that?
I haven't seen it. People said O blood, O positive, O negative, didn't get it. I'm O positive. And
there were some early indications, early research. One of the first studies really that suggested that it correlated with blood group. That was a very low grade correlation, and I'm not sure that it's been carried forward. It's minimally important, we believe, at this point.
Okay. And Amber, feel free to jump into these medical questions as well.
Okay.
Julie, do you have another one? I'll throw you one, and then.
Yeah, we had a question here. We had a question asking about, is there any data that's starting to come out about the impacts, the long-term impacts, besides people who had to be hospitalized? Like, a lot of what we're seeing is just hospital data, but like Barry's situation, you know, that kind of a story. Is there any data coming out about that yet?
We're still collecting data. That's part of the problem. I'm in one of the first post-COVID centers. It's in Mount Sinai Hospital in New York. I'm going back there for a 6-month follow-up this Friday, but we're helping them. They're helping us. We're still collecting data on the lung. There is, I can put a link in the comments to one guy in the UK who is doing some research on long haulers. Gez Medinger, Gez Medinger is his name. You can find him on YouTube.
Okay, great.
So far, I'll just say that infectious disease at UK, and that's who I've been dealing with, they don't have any post-COVID clinics set up. However, the need is coming. I mean, obviously, if you look at these numbers, the severity of the course of illness does not correlate to long-term issues. So if you look at all these numbers of infections, not everybody's in the hospital, not everybody's on a ventilator, and there are tons of people, you know, at home, as we all, the three of us were, who all have various things going on that are going to need to be addressed. And it is very hard post-COVID to go to a primary care, especially in a rural area, and to get them to be able to get you referred out. I mean, if you need a pulmonary referral, you're 6 months out. So, you know, it's just everybody is taking care of the acute need right now with the hospitalizations. And it's really going to take a lot of time before we can catch up and set up post-COVID clinics to be able to take care of people who have been at home and have these long-lasting effects. I have had so many people reach out to me as a healthcare provider in a small area who knew me and knew my story, just begging me, like, what can I do? Where do I go to get help? Nobody believes me. And then what I'm seeing is patients that have come out of the hospital, geriatric patients, or even, you know, I'm going to say 55 to 75 year olds coming out who have been very sick. There's limited nursing home or rehab beds. So now they're coming home a lot sicker than we have seen. And so we're trying to help their families manage them at home. So it's not just the hospital being pushed right now, even just primary care clinics in addition to community care is just really taking a beating, and it's not going to get better. As you see from Dr. Hasselbacher's numbers, we haven't even hit the real iceberg.
All right,
It's going to be
Unfortunately.
hard to determine
go ahead.
It's going to be hard to determine the long-term outcomes in our multiply fragmented, ineffective medical system, which many people can't even participate in. I'm hopeful that now, when we use these vaccines that have been shown to prevent symptomatic COVID disease, we have to test them for the long-term safety. So I'm hoping that we can piggyback some long-term follow-up on all the people that are getting immunized, who are going to have to be booked somewhere because they need more than one shot and followed up. I'm hopeful that we can get some useful information from that.
Yeah, that was actually going to be my next question, you know, hopefulness of the vaccine. So I'm glad you brought that up. You know, apparently that could be out any day now. So, so that's,
It'll be out any day, but you know, even conservative folks are saying it's going to be end of next year by the time it becomes generally available, even to healthy old people like me. End of next year, I meant.
Yeah. Julie, do you have any other quick questions before we?
No, just lots of people saying thank you for sharing your stories. So I second that. Thank you all so much for coming on here and talking with us. I think it's just so important that we get the information out to people so they can understand the importance of it, and that it's not, you know, just the flu, and it's not something that is to be taken lightly at all. So hopefully this will help keep encouraging all of us, you know, as we're heading up to Christmas, and we all want to see our families and we want to see our friends and spend time together, but we don't want to continue to see the kind of things we are, or other people have to suffer like you all are. So thank you for being part of sharing that.
You're welcome.
Well, thank you for having us.
Yeah.
Thank you very much for being on. This is really important. You know, I haven't seen a whole lot of things like this. From time to time, we see it on the news or whatever, but for people, especially locally, to be able to reach out and share their stories, especially the ones that you guys just did, that's, you know, I think that's very, very helpful. So thank you all very much for being on the show. It's much appreciated. All right. So
All right.
you're very welcome. Welcome back anytime. Our next show will be next week at the same place and same time, 7 p.m. Next week, we'll have former auditor, former gubernatorial candidate, Adam Edlund, who's now a solar entrepreneur, and real estate solar entrepreneur, Chad Dickerson, and John Cotton, who manages a solar company. We're going to be talking about solar next week. So that's going to be really interesting, something I'm interested in. And the week after, we're going to be doing something a little bit different. It'll be 2 days before Christmas, Christmas Eve. So we're going to have a Christmas music. It's actually not going to be Christmas music, but we're going to have a live music special So we're gonna host 3 or 4 local musicians. There might be some Christmas music on there too. That'll be on December 23rd. And again, I want to thank our guests for coming on. I know, thank you for taking time out of your day. I know Astari's still not really feeling well, so thank you for being on.
Absolutely.
So until we have a vaccine and medical experts give us the green light, it's important that we stay safe and in our homes the best we can.
Yeah.
We can go out and do things, but please be very careful and judicious about that. So thank you, everybody, and see you again next time. Have a good one.
Bye. Thank you.
All right, the live stream is stopped.
All right. I just posted a link in the comments for one of the guys who's really following the whole long haul thing.
All right.
He's dealing with it himself over in the UK, and he's been collecting a lot of data. That's kind of how it's been going. We've have to teach ourselves.
Mm-hmm. Yeah. Well, thank you all so much. And again, I know I've already said it, but thank you for sharing your stories, and
of course,
continue to feel better. Continue to stay healthy.
The best part is that even with COVID, even though I don't feel well, I can still work. Like I was able to go back to work in 3 weeks, instead of a month or 2 months. But man, there's still some days where I don't even want to go to work. I have to talk to too many people, and I'm like, no, I can't today.
That's the thing. Even talking on Zoom can be exhausting. I found that out too.
Yeah.
Mm-hmm. Yeah, and I'm just like, I can't today. Like I can't, because and with legal, I work for legal aid, so there's lots of empathy and sympathy that has to go into some of our clients, and and I don't say that in a bad way, because normally I have it's up to here, I have it all, but on on any given day I might wake up and just be like, I can't today, my face, everything, I can't. I have to call in.
Yeah. Well, I'm glad you're starting to feel better. I'm glad, Amber, that you made it through your very rough.
Yes, Amber.
Long period of time, and Barry too. And Julie, thanks again for being co-host. And Peter, thank you for being on. We really appreciate the medical advice.
Thank you so much.
A privilege.
And Amber, Julie, Peter, if there's any resources I can give you guys, I've been at this for a while as far as recovery and helping and what's worked for me, then feel free to reach out. I've done a lot of things. So
the one thing I found that worked for me that I had never taken before in my life was that horrible BC powder that you pour into your mouth. I've never taken that before in my life. And for the first, do you know what I'm talking about? It's literally.
No.
So it's called BC headache powder, and it's
loaded with
acid. I haven't heard anybody talk about those things in 50 years.
I didn't realize they were on
the powder, honey.
Oh my God.
I have never, ever taken one. I think they're disgusting, but it was the only thing that helped with body aches.
Wow.
I mean, it helped better than anything I'd ever had. Normally, I'm an Aleve girl. Give me Aleve, it works. I had 2 C-sections, took Aleve. Aleve wasn't doing anything with Corona. It wasn't helping.
Wow.
But that BC headache powder, I mean, it was I could sleep, I could move, I could get up and down out of the bed. It was great.
Noted. I'll keep an eye.
So we got to go back to whatever they were doing 50 to 100 years ago for medicine, hot toddies and BC powder.
There you go.
Of anything, right?
Yes.
Awesome.
I hope to see you all in real life again someday.
Yeah.
Thank you so much. It was fun.
Thanks to all of you.
Have a good
Thanks
one,
for having
everybody.
us.
Thanks a lot.
Bye.
Bye.
Bye.